Hi, this is Dr. Krishna Das. We're going to talk about the strategy on which exam selective you should choose if you're an administrator. So for the Part 3 written research exam, you have to choose 2 exam selectives. Each selective consists of 50 questions, so there will be a total of 100 questions. So if you're an administrator and you're a generalist, then we're going to continue forward. If you're a subspecialist, then I would refer you to our snippet that we have specific for subspecialists and follow that recommendation. So again, this is applicable to if you are an administrator who has a generalist background. So as a generalist, you must choose from one of the 4 options. OB/GYN in office, OB only, GYN only, or office only. Book B are the same options as A. Now, in my mind, a stereotypic administrator I really would break it down into 2 groups. Those of y'all who have been an administrator for 3 or fewer years since you've been in practice, and those who it's been more than 3 years. If it's only been 3 years, then you would go back to the type of mode of practice you had when you were practicing. We have snippets that are applicable if you did office GYN only, a snippet if you were GYN predominantly major only, you were a true generalist if you did OB only, and again we have the subspecialist. Now, I think this is pertinent more for if you've been an administrator for 3 or more years since you've been in practice. To me, that means you certainly haven't delivered a baby in a long time. You're not doing any major GYN surgery, and you're not even seeing patients. So I would not choose anything with obstetrics in it, so that would eliminate 1 and 2. Because you're not doing major surgery, I think that's kind of hard to pull that rabbit out of your hat. So I think you're really stuck with really only option 4. Just to kind of drive in that nail, the reason for my recommendation, the GYN selective really focuses more on major benign GYN surgery, the preoperative evaluation and diagnosis, intraoperatively technical challenges, as well as recognizing complications and managing them intraoperatively and postoperatively, and that also can include GYN oncology. The OB as well, it's OB. It's preconception and antepartum care, intrapartum care, and postpartum care. The office is really well-woman routine care, which as an administrator, I would think you would be dabbling more in that. Here's the one downside is that it includes medical problems, which includes really primary care. And then well-woman GYN specific minor office procedures like LEAPS hysteroscopy. So if you're an administrator with that particular prototype that I enumerated, then I would recommend for both Book A and B that you choose office. Some resources we have available, I strongly would recommend our one-day mock workshop because we'll go through the high-yield articles with accompanying questions. If for some reason you can't attend that, you can purchase the binder. The review course, I think it is really your best bet because it will be all-inclusive. It would be great to refresh you on all the different topics, and I think you're going to have an easier chance of recalling if you've just heard that. I think it would be very difficult to go back and review all of general OB/GYN on your own. Written question manuals, if I were taking office selectives, I would choose our office and our GYN. Because the test is on the computer, you can access the Jolly Diagnostic Computer banks via our website. You could consider getting the annual mock manuals, which will go through all of the articles and summarize each article and overlapping questions. I remind you also to go back to your personal homepage on your ABOG website and look at those questions on their practice test in the hope that perhaps they can recycle those. And then if you have time, I would consider getting the ACOG Office Prologue. So I hope this is helpful for you in choosing your exam selectives if you are an administrator.